Pharma giant Merck is suing the Biden administration over not being able to screw over the taxpayer. Now, the lawsuit filed by this giant pharmaceutical company in Washington, D.C., centers over a recently enacted law that empowers Medicare to directly negotiate the prices of a small number of high-cost prescription drugs with drug makers. So this was part of the Inflation Reduction Act. Look, this part with Medicare negotiating prescription drugs was incredibly weak. It was very, very limited. And still, this is too much. It's far too much for Merck. Because, of course. Now, Merck's lawsuit characterizes the drug price negotiation policy established by the IRA as quote-unquote tantamount to extortion. Wow. And claims the singular purpose of this scheme is for Medicare to obtain prescription drugs without paying fair market value. I'm trying not to swear. Okay? But wow. Fair market value. Please.
Really?
Wow. No, these companies, they don't charge fair market value. No, and they do so because they have a monopoly on certain prescription drugs due to patent trolling. They take out these patents for 30, 40 years, sometimes 100 years, and sit on it so that there are no, generics that can be made. They sit on the formula. They barely even improve it or do anything to it, and then charge just ungodly amounts of money for life-saving prescription medication. That's what they do. And they want to sit there and complain about fair market value. Oh, how dare you not let us price gouge people? No, it's utter bunk. Now, the lawsuit against the HHS and the Centers for Medicare and Medicaid Services also alleges that the drug price negotiations, quote, made a mockery of the First Amendment by conscripting companies to legitimize government extortion. Again, they're talking about extortion when literally that is essentially their business model: your money or your life. Oh, you need this prescription drug for cancer, so you don't literally die of cancer. That'll be $90,000, please. And that's just a cheaper one. No, look, in the United States, Americans spend more money on prescription drugs per capita than citizens in any other country. And you know why? Again, that's because of corporate extortion. Which is why, according to a Kaiser Family Foundation health tracking poll published earlier this year, 8 in 10 adults said the cost of prescription medications was unreasonable, and the CDC released data last week showing that more than 9 million Americans have been delaying medication refills, skipping doses, or taking smaller doses than prescribed due to the high costs of medication. Because, fair market value, something fair market value. Okay. Now, these companies, though, they say, well, we can't. I mean, we have to extort people. We have to charge such high prices because, we spent so much money doing research and development on these drugs. And therefore, it's justified. It's the market. It's the market. Not true. According to a paper published in September of 2022 in the JAMA, which compared data on R&D costs with the drug prices of 60 medications, researchers found no relationship between what they spent on R&D and what they charged for these new medications. The authors also assessed that whether the therapeutic value of a product was associated with the price, but again, found no association there either. So this is according to Immaculata Hernandez, who is an associate professor at Skaggs School of Pharmacy and Pharmaceutical Sciences, quote, "Our findings provide evidence that drug companies do not set prices based on how much they spend on R&D or even how good a drug is. Instead, they charge what the market will bear." What does that mean? Basically, They set out an arbitrary price on how much people are willing to pay for a life-saving drug, or in this case, the government, the taxpayer, through Medicare. They will then charge the maximum amount and not a cent lower. And that's it. That's how they make their money. She says, if this argument is to be used to justify high prices and oppose measures to curb prescription drug costs, drug companies should simply should supply further data to support their claims that high drug prices are needed to recover R&D investments, said Hernandez. Well, that's the thing. They can't justify it. They don't have any evidence to, support their claims. They don't have it at all. And what they're doing instead, by the way, of making drugs affordable, they use their massive profits to file lawsuits to screw you over, in two ways. Both as taxpayers and people who may need to use those drugs. In fact, one of the drugs at the center of this lawsuit is Keytruda, that is Merck's new cancer drug. That carries an annual list price of $175,000. So now, if you're someone that has cancer, you can't really go, I could probably go without this. A little too pricey for my blood. No, you're dying. You have cancer, and so in order to get rid of the cancer, you have to take these medications. I mean, this is extortion. You're going to need that drug to survive. Now, as the New York Times noted on Tuesday, Merck's Keytruda could be among the first products targeted when negotiations begin in 2028 on drugs administered in a healthcare setting. So again, this doesn't even start until 2028. And they're already suing the Biden administration. Now, the Times reported that Merck had been expecting to bring in significant revenue, or I should say profit, from a new formulation of Keytruda it is developing that can be more easily given under the skin. That could be subject to negotiation, too, under the government's plans for the program. And that's why they don't want it to be part of that. Again, this is what they do. They will make subtle changes, maybe even changes to, for example, insulin in the injector. Again, which might cost a little bit more to manufacture. We're talking pennies in the dollar. And yet they think, oh, no, we can justify now jacking up the price, making, 1,000% markup, because our pockets were feeling a little bit light that day. And we just, we have a fiduciary responsibility to maximize profit. And there we go. Now, again, the result of this is that the U.S. government spends billions of dollars in taxpayer money helping patients to cover the cost of medication. Now, the correct thing is not to kick people off government assistance. The correct thing is to use the power of the government to negotiate prescription drug prices so that they go down, so that more people can have access to these drugs. Instead, the Merck is basically trying to force the government into not being able to do that, so that they can pocket billions of dollars in taxpayer money, as well as consumer spending, people that, again, need these drugs to survive, and give it to their shareholders, the executives, and the CEO. And that's it. Now, Robert Weissman, president of the consumer advocacy group Public Citizen, said in a statement on Tuesday that Merck is claiming the U.S. Constitution requires the government and people to be suckers. True. But he says that's not true. This lawsuit is a desperate attempt by the industry to beat back popular legislation that would curtail Big Pharma's ability to price gouge Medicare and secure monopoly profits. Full stop. While Big Pharma's litigation gamut plays out, it's critical that the federal government continue its preparation for price negotiations, Weissman added. Delay in the commencement of long overdue negotiations will result in billions of dollars in excess costs for taxpayers and consumers, which, by the way, these companies are counting on, because of course. No one needs to read Merck's fancy lawsuit lawyer talk or PR spin denote what this is all about. It is about them wanting to continue to fleece taxpayers and gouge seniors. Now, the CBO concluded earlier this year that the price negotiations will lower average drug prices in Medicare and reduce the budget deficit by $25 billion in 2031. I'm not really concerned about the budget deficit, but I am concerned, about the prices that average people are willing to pay. And by the way, the taxpayer as well, as I am one. Now, these companies who are already massively wealthy, if this is allowed to go through, well, that means they're going to lose some profit. To which they say,
"Oh no!
How will they? How will we not be able to survive if we can't have our CEO buy a third yacht?" What about the people that are being fleeced? What about them? Anybody think about them? No, they don't care. Again, these corporations are machines with one purpose: to extract profit. They have a fiduciary responsibility to maximize profit for the shareholders. And if that means that you have to die for them to make an extra buck, well, it's a sad day for you. That's it. Yeah, that's what it's about. Jorge, head of the Lower Drug Prices Now campaign, said on Tuesday as well that Merck's lawsuit is nothing but a political stunt motivated by the same shameless greed that we're used to seeing from drug corporations that have made decades of inflated profits at the expense of patients' health and taxpayers' hard-earned money. So there's plenty of pushback here, but I am concerned. Again, whenever something goes to legislation, whenever something goes to court, I get concerned. Because you did have a lot of Trump appointees getting put into judgeships, and you also have, if it gets to this point, a Supreme Court that is wholly owned by corporations and looks out for incredibly wealthy billionaires and big companies. So it's always my concern when there are these kinds of corporate lawsuits, which, by the way, could possibly hold up legislation. Doesn't necessarily mean that it has to, but it could. And again, lead to, these companies continuing to extract all of this profit as people continue to not be able to afford medications they need to survive. It's just absolutely horrifying. And another example of how, unfortunately, in the United States, we are living under corporate rule. And that is not here to serve us. It is here to serve only a few at the expense of the rest of us.